Welcome to the office.
Hi, Susan.
Hi.
Welcome back.
Thank you.
So, guys, Susan and Vince came many years back, over 3 years ago. And it was an interesting first week or first day. So, just a quick recap. You started as the patient. Mm-hmm. Vince came a little bit later on. He was the skeptic to believer.
He drove me to get here.
But he didn't, I mean, it was, how far is the drive?
We were 6 hours, 5-6 hours. Yeah.
5-6 hour drive. And it didn't really seem like, why do I got to drive 5-6 hours to get a crack? No, it's
well, sure. In our history of chiropractors, absolutely. He was like, okay, whatever if that's what you think, then let's go.
Okay, because you had already tried a lot of other stuff back then.
The doctor wanted me to have surgery, and I absolutely refused to go that route, period.
Do you remember that week? You booked for the week.
I remember that week very well.
And I remember the first x-ray, and we gave her first adjustment. Mm-hmm. And I said, I don't know what's going to happen when you go home or hotel, right? And there was a lot of toxicity in the body.
How does that happen? Is it as above, so below? I mean, really,
what are you talking about?
How does that happen?
What?
How does the toxicity?
Life, environment, food, stress, drugs, alcohol. I'm not saying you do drugs.
So
it's life. It's everything. We live in this toxic digital.
I used to feel a lot more resilient, and I don't now.
As we get older, it becomes a little more harder, and we need to take a little bit better care. And we'll talk about those things on this trip, okay? She got her atlas adjusted, I remember, parasympathetic. You went back to the hotel, and that was a Monday.
That was a Monday.
And what happened?
For the next 3 days, I purged a lot of the toxicity that was in my body.
And
a lot of it.
You remember that, sir?
Mm-hmm.
And you came back on the Friday.
I think so, yes.
And you lost about 20 pounds. Mm-hmm. All toxicity. Yep. Yeah. And well, we saw you for a bit. You guys came down, sun came down. And then I didn't see you guys for a little bit. Mm-hmm. And I told you to find somebody closer to you to continue the work. What happened?
I found a Gonstead chiropractor closer to me.
Okay.
And
because we wanted you to.
Right. And
I wasn't getting rid of you.
No.
I just wanted to make life easy for you guys.
So I said, maybe we can find somebody closer since this method actually works.
Okay.
So I found somebody closer to home.
Sure.
And I said, from where he came, and he said, they usually don't take Dr. Rahim's patients because Dr. Rahim is like the gold standard of Gonstead. And so I had a little bit of hesitation then. I thought, that's interesting. If you do a good job, you should be fine. Seriously.
And it's 3 years.
3 years.
What happened? What's going on?
I lost both my parents.
Sorry to hear that.
And my mom's death was hard because hers was voluntary.
Hers was voluntary?
Yeah. Mm. It was planned and legal. Doesn't make it right. It was really hard for me, and I was alone with her. It doesn't make it better
either, right?
I thought it would be better by now, but it doesn't seem to be getting better.
Yeah.
And then my best friend passed away, and we weren't on good terms, and I regret how I handled that. And then we had to put my dog down a few weeks ago, and that was really rough. That's about it.
That's it?
That's about it. Kids moving in, kids moving out.
Life.
It's life. I don't. I used to be so resilient and have so much energy.
You know they're not suffering now, right?
Who, my parents?
Yeah.
Right. There's some things that, with my mom especially, the way things would happen, and I don't agree with that. Euthanasia in people or animals. That's just my heart.
I get it.
And so going through that for me was very hard.
I'm sorry. I'm really sorry. That's tough.
She's been any of the kids 2 years and younger, and she's keeping on taking my watching.
Yeah. Well, that's my purpose.
About 2 years ago.
Come on over here. Come on over. Come on over, Vince. What happened 2 years ago?
She was babysitting, and I think this just whacked out her adjustment from the first time because she was wonderful.
So she was holding well when you left.
Oh,
Yes.
For a long time.
And how long after did you go get checked then? Was it at least 6
Right,
months?
A year and a half.
Oh,
year and a
wow.
half, year and a
Oh,
half.
good.
That's great. So
Damn, you should have come back
she
here.
had a toddler, Luna, and she put her down from
I put her
one
down
level,
over the
one
baby gate to
level
the steps.
another
You know, when
level.
kids
Yeah.
lift their legs up
And
and something pulled
something
down here and
happened in her
it's
back.
never healed.
And
That was a year and a half ago.
it was probably 2.
Probably
2 years ago, okay.
Yeah.
She just went on with it, and then she hit her head,
Oh yeah.
and the headaches were really bad to where, like the first time we came down, she couldn't get out of bed for a few days, just in pain. So
Yeah.
I said, "Cole, you got to go. I got to get you down there. You have to go."
Okay.
So she's had a couple of incidents since then, but yeah, the first time she had the little scoliosis.
Okay. So let's see what we got to do to get you back on track, okay? And shall we talk about you while we're here?
Sure.
What's going on with you, Vince?
Just getting old, I reckon.
Getting old?
Little-
We young, baby.
a little
We
rusty.
We young and hot. Tune-up time?
But yes,
Did any new injury happen since I saw you?
no, not other than just work.
Life stuff, right? No major accident.
Right before we came.
On the street.
I mean, if he's gonna do it, it's the best time to do it, right?
Curb disappeared.
He never falls.
But no
No.
slips, falls. Besides whatever happened recent, car accidents, work, anything.
Nope, nothing.
Just
serious.
life stuff.
Yes, pushing it to the limit.
And what are you feeling the most right now? Everything's kind of out.
It's definitely down in the basement.
Mm-hmm.
I think it's 5, but
Okay.
and my shoulder arthritic or something. I don't know. I mean, it's just
No. Tell me. So
different
you're
than
feeling
this one.
you're feeling your low back, number one.
Yes.
You're feeling restriction or pain in the shoulder or both.
Restriction, and it's not real hard pain. It's about a 3.
Okay.
But it's constant at night. I can't get comfortable.
So it's nagging.
It's nagging pain.
Got it. And it's all the time.
It's getting worse. About 2 months ago it started, and now it's like every day. I
Okay.
can feel it.
All right.
It knocks all the time.
All right. We'll take a look at your new X-rays. We took some new X-rays with you guys.
And
What else?
the C1, C2 area seems to be okay. I don't get headaches anymore, but I know that the whiplash that I had is still there. It probably is not where you want it to be or where I need it to be, but
we need it.
it's not in pain.
Okay. We just need to make sure it's clear.
Yeah,
We need to make sure it's
it's
clear.
just my pelvis and my L5.
Okay. So you're feeling hips, L5, feet,
Fine.
good. You're working.
I'm going back to work Monday. I've been off for 2 months.
Oh, because of this or family?
No, just for work-related stuff.
Okay.
Timing on the job, and called me back.
Okay. But this is not work-related stuff.
No.
Okay. No problem. And
I have emotional whiplash.
guys, that's worse than a car accident.
That's what it feels
Let me tell you. All right, you ready to let it out?
She's first or I'm first?
like.
I think your choice. You want to go first? Okay. Okay, so this is 12-14-7-1. This is 21. This is 22. And from where we started, remember, 3 millimeter MD became 1, PI 2 IN7 became PI 4 IN6, and then we had a switch. We went from left to right on this X-ray. You remember? I don't know if you remember this or not. Okay, no problem. Now we're going to look at where we're at today. So if we look at today, it shifted again. Is that emotional whiplash? Was there some physical traumas? Yeah, you had more physical stuff too. And whatever it was.
I don't remember that, but that's all right.
No slips, no falls, no nothing you recall? I don't think emotional itself caused all this. Okay, well, this is where we're at. Okay, we have PI2, we have IN11, so we got a pretty twisted pelvis today. Rotate. Now, this is interesting because this is not supposed to happen either, and I don't have the answer just yet. I've measured it exactly the same. P2 went on the right, went to P3 on the left, which doesn't make kind of sense to me, but we'll figure out what we find on you. So the major that I'm finding today is we have a lot of rotation of this pelvis, and we need to work on that. IN11 is the major with the rotated sacrum on that side. Book says do the tailbone first. We'll see what we find. We got to do the tailbone and we got to do your pelvis. Okay? Now, as we work our way up, let's look at it. Let's see if anything else. So we already know we had the scoliosis there, okay? And our goal and our job back then was we're not fixing the spine. Like we're not straightening out that wasn't our goal. Our goal is get foundation, stabilize, find a new balance point, and get on with life, okay? So all of this goes back again to here. All of this is compensation. Even when we look at the upper neck here, it goes like this. It tilts to that left side, and then we're tilted on the right on the atlas. However, it's what we're going to find on you because all of this we know is compensating for everything.
I would think it starts from here because my upper cervical and my jaws are on fire. I thought that, well, okay.
No, I'm not saying you don't have upper cervical. What I'm saying is, look, if we take a line from here and we run it straight up, look where you're at. You're off to the side, right? So being off to the side there, your atlas is compensating. How? Look, you're going to the left. So the atlas is trying to keep your head straight and eyes level. And so if we're looking at it from this point, if there's pressure there, of course I'm going to deal with it and clear you. But what I'm showing you on this x-ray here today is whatever is going on up top here is part or secondary to the foundation still. Okay? That's what I'm saying there. Now, side profile, this is the fun one. Let's look at the fun one. So when we look here, we see that's our tailbone, 5. 4 has gone. Let's see. Oh, okay. No, it's fine. It didn't get any worse. But look at what happened to your 5. You see how that disc looks more level there? It's more tilted. It's tilted because of the pelvis being twisted.
I can tell. I really, even walking last night, my lower back is on fire. I can't walk that far.
So we're gonna now let's go up. Let's look at the discs and see where we're at. 5, 4, 3, 2. This is going to be foundation and cervical. Now look at our cervical. And we already know we had this going on last time, right? We knew that what was going on here in the neck. And the idea here is we're just trying to get her stable. Sure, do you need, any ortho looks at this, any doctor looks at it, is like, oh, you need surgery.
That's right.
Right. And what I'm seeing today is we need to work on 2, 3, 4, 5. We need to open up 6 and 7 because it's starting to
fuse.
Yes. You feel that, right?
I do.
Okay. So again, let's see what's going to happen with all of it. But I want to show one other thing. This is really interesting. This was our first x-ray. Okay? And just want to... So what I was talking about was all this stuff that I was seeing in here. And when we look at it, this one, it's not the same. Okay? There's less consolidation in your lungs than there was before. You had a lot of consolidation. Remember I was talking about the toxicity. So there's definitely a lot less toxicity. Let's go ahead and let us... So going back to this, guys, It's stabilizing this, finding a new balance point. I mean, and it depends on lifestyle. And yes, surgery is an option if the patient wants it. But the question is for what?
To have flexibility. That's not a route I would really want to go down.
So the
ever.
question is this, and if you have a choice, okay, here's a good question. If it's pain and stiffness is one thing. Pain, stiffness, radiculopathy, another thing. Pain, stiffness, radiculopathy, loss of organ function, that's pretty serious.
That is pretty serious.
Just stiffness without all the shooting pains and everything. If there's stiffness, you have to ask the question, are you okay with being stiff but not having pain? Okay? It's something that we have to kind of be...
How would surgery fix stiffness?
Well, it depends what they're talking about doing. If they're putting in new discs, then you'll have a little more flexibility in those joints. They do disc replacements. If they're just going to fuse it up with some rods, then you're not getting more mobility. That's more for neurological issues, okay? And if you're looking at more range of motion with less neurological symptoms, there are people that do the disc replacement. There's a case I'm working on right now. He had 2 disc replacements.
Upper cervical?
C3 and C5. The problem is it's with C7. But,
Oof.
I have my issue with those things. They did a great job on the surgery, and it was good that they did that and didn't fuse him because I was still able to help him. He still couldn't get his arm up there, and we got it up on the first adjustment.
Is my lower back fusing at all? It's just so,
Yes.
like when I
You have
walk,
scar tissue, ma'am.
because I used to have I walk along now, walking to a short distance, my lower back burns.
This stuff is fusing in here, but the low back, you have the spondy at L4. Okay, it's the L4 spondy. Your hips are good, ma'am. You still have good hip sockets. Okay, so I'm okay with that. So what I'm seeing here, I want to work on your tailbone and pelvis and whatever else we find along the way. Looking at the upper cervical, I actually want to work on the lower as well on this trip. And you're here for the few days with us, right? Okay. All right, does that make sense where we're at? Okay. Yeah, you did something too. Something happened. Okay. So let's go over your x-rays, Vince. So this is the new x-ray. This is the looking from behind. This is the side profile. And I'm just going to do a quick comparison of the two. This is before. This is after. And the biggest difference we have, things have shifted quite a bit with him. We went from a P1R to P2R, down 2 on the right, went down 1 on the left. But the biggest thing is he went from a 2MD to an 8MD, and which doesn't make a lot of sense, but we're going to just fix whatever we can. On the side profile, this is there, and this is the new one. This is the old one we started with here. And what we see is you are actually more upright, but the neck is a little bit, so here's the thing, it's not that the spine is tilting back more, it's that your reverse curve is more. Okay? You see that? This is a little bit more, but this is more upright compared to this. The thing I am seeing and we need to really work on is his tailbone. We're going to work on the coccyx there. We're going to work on his L5 disc, and we're going to probably work on his pelvis, I'm pretty sure, on this trip, in terms of the low back. In terms of up top, we need to work on, and we need to work on his digestion. In terms of the top, we need to work on 6, and if upper cervical shows up, we'll deal with that as well. But his upper cervicals look great there. Jealous.
A little bit.
Okay, so let's go ahead and get started. Okay, Susan will go first.
So I saw after PRP, there were lumps in my back that
You
weren't
had
there
PRP?
before. I had PRP, and it
Did
was
it help?
expensive. Well, I'm out back here. I did not go back to PRP. It's expensive. It didn't hold for, like this man here. Nothing does. We've been to chiropractors, PRP. When we're back there again,
How much is PRP? I don't even know.
it was about
Couple
$5,000.
thousand?
$5,000 for one.
$5,000 for how many joints?
I was there for 2.5 hours. She did upper
Starting at the
cervical,
base.
and then she tapped T8, but she said my lumbar was twisted and PRP could not fix it.
Starting at the base of the neck, C6, C7, left side. Oi, C1. C1, maybe occiput, left side. And it's also interesting, we got a lot of patients coming back after many, many years. And in the beginning, when patients would come, we'd work on them quite a bit, and then they disappear. I was like, thought something was wrong, and then I'd run into them after years, and like, oh yeah, you fixed me up.
Mm-hmm.
I'm like, yeah, but you disappeared. You didn't even call and say what's up. You didn't even answer no phone. Not you guys. I'm just saying general. And it's always nice, you know. And I know the followers even, they like to know what's up with everybody. And so it's good to see you guys. I was just talking about you guys last week. It was actually interesting because I had a similar case to yours.
Oh, did you?
Yeah.
We should meet and have a little conversation.
T9, 5 points. And we're down in the basement. S3, S4, left side. Let's check the hips. Scoot forward a little bit, please. Feet together. Open and close your knees with your feet touching. Right side only. When she does the right, this whole thing is shifting. You can see it's just, the whole thing bends. Left side only. Right's a little stuck too, but not like the left.
This is not easy to do, just this.
Because the hip is turned in, she's trying to do this. It's that ion ilium that's holding her up. Sit back for me, please. All right. Come back slowly in extension. Good. That's 5. That's 1. That's 2. That's the one I'm getting.
That's the one.
That's 4. No. It's 3.
It's 3.
3. Left hip.
Oh, so when you say occiput, would that include blurry vision?
C1, yeah. I mean, blurry vision can come from C2. Blurry vision can come from T9.
Really?
Yeah. Ask me how.
Where does the sweet tooth come from?
T7.
And that one's fine?
1, 2, 3, 4, 5, 6, 7, 8. That's 9. That's 8. 9 more tender or 8?
Neither one.
9
that is more stiff.
or
Yeah.
10? 9 is more stiff.
Mm-hmm.
Okay. 9 can cause blurry vision through the epinephrine response of the adrenal cortex. Epinephrine is produced in the adrenals, and it is responsible for opening and closing of the iris, right? Left side, C1.
Oh.
Yeah.
My discs are like...
Yeah. 6. 7 or 6. 1 is there. All right, let's play Jenga. Let's play Jenga. 4, 5, 6. Nope, 7. All right, let's take a look. Do, 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 do. Let me have it. Chin, look down. Okay, look up. Turn. That's 7. Okay. Here's the game plan for today.
I'm shaking.
What?
I don't know. It's just an internal spinal shake.
Okay.
It's like,
T9, adrenals, stress.
that's what it feels like.
Let's do T9.
Okay.
Get that calm first. Then we're going to do the tailbone. Then I'll have you walk. Then we'll do the pelvis. Then we'll do the neck. Okay? You ready?
I'm ready.
Check out my new table.
Beautiful.
Come on over.
Okay.
Nice. Deep breath, man. Deep breath, man. Thing is fused, dude. There you go. Slide up a little more, please. And we want to bring the left 1, 2, 3, 4, 3. Let's use the drop. That's the home run. Gotcha. I'm going to bring you up now, okay? Walk to the corner. And then back in the chair over here, please. Let's recheck.
I can breathe easier.
T9 is clear. S3 is clear. Now let's see what happened here. I cleared her bottom neck, and C1 is there. So we'll do C1, okay?
Okay.
Your favorite one, right? You should make me work for this one. Sit back for me, please. Scoot to the left. There you go. It's actually C2 on the right, C1 on the left. So we need to do 2 first in order for it to hold. Drop the elbow. Oh, wow. Let's go over here. We're going to have to do it face down. Chin down. Come over here. I want you to see this. So we're C2, big spinous bifid. That's the left bifid. That's the right. We want to be on the right side, coming under it. Flat hand. And we need to lift up and through. There you go. Hi. Turn your head to the left. Turn your body with it a little bit, please. Put your right ear in the hole. You okay with that? Turn your body so you don't feel so twisted. Are you okay there? Left hand up here. Are we good?
Mm-hmm.
You tell me go.
Go.
Okay. Drop the elbow. Nope. Turn this in more. Turn your body a little more. There it is. Gotcha. Head down, please.
Ooh.
Hi. How's it going? How you going? It moved. Deep breathing. Deep breathing. Deep breathing. Walk to the corner, please. Breath's a little easier.
Oh, wow. I'm occupying my physical body, which feels just good.
What happened?
It's kind of hard to get. I feel like I'm in my body. I don't know if that's grounding.
You came back?
I'm kind of like.
You're back in the body now?
I'm back in my body.
Good. Would you like to go again?
Yes.
No, you want to stay in your body, right?
Oh, no.
Okay.
I want to stay in.
Okay. Good stuff. Deep breath in, blow it out. Starting at the base, head down. Neck is clear. So we did C2 prone right, C1 left. T9 is clear. Tailbone is clear. So before I continue,
Wow.
you okay?
Ooh, that's been stuck for a minute.
Is it moving now?
It just feels like I can drop my shoulders.
Good. Come back slowly. Look at that. Hi.
Hi.
How's it going?
Very well, thank
Hey, how you
you.
doing?
Oh, show me how.
What's up?
Yes.
Yeah, what's up? How's that feel?
It feels good.
And that one?
That one?
A little bit here.
Not painful, just a little. I can feel a little bit, but I can't say pain.
Okay. All good. Go right side down.
Hi, the visionary.
Dr. POV. PIIN. Slide forward. Hold your wrist there. Bring this forward. Bring that forward. Let it roll.
Is my head in the right position?
You are perfect as long as you're comfortable. Are you comfy there?
Uh-huh.
Hold.
Susan.
Let it go, Susan. Let it roll. There you go. Start the process. Come on up. Get out. Uh-huh.
Color coming back?
A little bit. Actually, it's
It's very
nice. It's very pink.
Boy, I sure do have the chills.
Huh?
I sure do have the chills this time.
You do or you don't?
I do. I have the chills.
Come on back over here. Have a seat. Hi. Ears. Shoulders. There you go. And now I got to clean up everyone's mess, right? Right?
That's right.
Stand up. Now you're going to make me clean everybody's mess. Squeeze the hand. You're tough. Okay, squeeze. Relax the hand. Squeeze. Posture eliminate. Scaphoid. Thumb. You're all set?
Thank you.
You're welcome. Starting at the base. All right. Up in the penthouse, C1. C1. L5. It's a tiny bit though, it's not a lot. It's 5 points, 6 points. Tailbone is clear. With you, we want to check your pelvis, we said, right? Also. So let's do static palpation. Running our fingers down the spine. All right, that's good. Come back slowly. That's 5. That's 4. That's 5. That's 1. No, not 1. 5. All right, let's check the hips. Feet together, feet touching the floor. Scoot forward. Open and close your knees with your feet touching. Open and close. Open and close. Right side only, please. Good. When he does the right, the whole left shifts. Left side only, please. Right side is fine. You guys like giving each other the same thing, dude. What's up?
Sometimes I take her headaches away.
Is that right?
Is your headache gone?
Yeah.
I got
He's
it.
an empath. He's an empath. L5, left hip. Sit back for me, please, sir. Head back. C1. Okay. Here's the plan for him. C1. Left hip. We're going to push the left hip up first on the side. Then we're going to do C1. Then we're going to come over here. L5. I'll start nice on this table. Tomorrow we'll go down. You want? No, tomorrow I'm saving that for you downstairs, dude.
Take it easy on my.
I'll take it easy, brother. Don't worry. Let's go right side down. Stand up for me, please, first. Let's bring this out. And let's go right side down. Hold your wrist. So it's just PI, fingers straight up. Let it roll. Let it roll. Let it roll. And we just want to push up. Come up slowly. And let's go face down over here, please. How you doing?
I'm all right.
How you doing? Drop board, a little easier. Shoulders down. I got you, brother. Just give him a minute. Just give him a minute.
He said I wasn't going to cry today.
I wasn't trying to make you cry today.
Oh, man.
I wasn't trying to make you cry today. I was actually being really nice. I mean, I did use the drop board.
Oh.
Yep. You ready to come up, sir?
Yeah.
Step away, sir.
Thank you.
You're welcome. Slowly walk. Nice. Just walk it off. What you think, Mama?
Spicy.
Spicy.
Spicy, boy.
Spicy.
Yeah, that's 3 years worth, I bet.
Mm-hmm. Have a seat, sir. Órale. Órale. Yeah, because 2, 3, 4, 5. Now, 6 is inferior. This is going to be an interesting C6. Because what I need to do is really get a lift. Lean back. That thing is tilting now. You try to set that thing straight, it's going to jam and it's going to hurt. And ain't nothing going to move. 7, 6, PL. Okay. PLS inferior. So for the inferior, here's 6. We got to come under. Okay. I got to come under and I got to lift. Okay. Under. Oy. You got to let me have it. Under, over. Oh, wow. It's tight, brother. I got you. But we got to lift. Oh, let's go back in the table. C6. And I'm going to do it. Get right under that spinous. Let's close this a little bit. Can you breathe okay, sir?
Yeah.
Chin down a little bit. And we want to lift. Gotcha.
Oh.
Bring him up. And then I want to do one more in the chair.
A little jolt,
Little jolt with
little
that.
jolt on both sides of the.
Come back. I got a little more still. Oh, wow. One more. There it is. Okay, let it drop, drop, drop. Wow. This guy's making me work. Got it. That's the home run. Stand up, walk it off once. Turn your head left and right. Mo better.
Yes.
Spicy?
No, not like that.
Come on back,
That
have a
first
seat.
one was.
Too spicy?
No, I mean, it happened.
Yeah. Neck is clear. Booyah! All clear, sir. All right. Go on your back, please. Raise your right leg. Slide up a little bit, please. Raise your left leg. Awesome. Sit up and turn. Shoulder. Shoulder. That's it. Ears. You're all set, brother. Stand up. Squeeze the hand. Squeeze the hand. I'm going to just buff out your L5 a little bit so you're not too sore. Have a seat. Let's just buff it out a tiny bit.
Okay.
You good, Susan? You doing okay there? You good, Vince?
Yes.
Go. All right, guys, you're all set. Welcome back to the office, sir.
Thank you. Thank you.
Stand up, please. It was a pleasure to see you again.
You
And
too.
we got a few visits here.
Yes.
Okay? Take care.
I see you tomorrow.
I'll see you tomorrow.